Sickle cell anemia. Sickle cell disease is a hereditary form of chronic hemolysis, ranging from asymptomatic to severe, overwhelming crisis. It is characterized by irreversibly sickled cells and recurrent painful crises. Autosomal recessive hereditary disease. Hemoglobin S is due to a substitution of a valine for glutamic acid as the sixth amino acid of the beta-globin chain. Heterozygous form, trait, 8% of African Americans. All those with the trait are asymptomatic. Homozygous form, disease, 1 in 400 African Americans. A sickle cell acute painful crisis may be precipitated by hypoxia, dehydration, acidosis, infection, and fever. However, the crisis may occur without the presence of these factors. Sickle cell crisis is usually not associated with an increase in hemolysis or drop in hematocrit. If increased hemolysis occurs, consider another etiology such as concomitant glucose 6-phosphate dehydrogenase deficiency, G6PD, or acute splenic sequestration in a child. If a sudden drop in hematocrit occurs, consider another etiology such as parvovirus B19 infection or folate deficiency. The drop in hematocrit is from acute aplasia, decrease in cell production, not from hemolysis. Presentation. It may present in children with anemia and mild jaundice. Children may develop digits of varying lengths from the hand and foot syndrome due to infarcts of small bones. Features of infarctive sickle crises include bone pain, usually limb bones, abdominal pain, chest, pleuritic pain, kidney, hematuria, spleen, painful infarcts, precipitated by cold, hypoxia, dehydration or infection. Other common manifestations of sickle cell disease these include bilirubin gallstones, osteomyelitis, retinopathy, stroke, enlarged heart, lower extremity skin ulcers and a vascular necrosis of the femoral head. X-ray is the first test. MRI is most accurate. Diagnostic tests. The best initial test is a peripheral smear. Howell-Jolly bodies can be found on smear in sickle cell disease. Sickle cell trait, as disease, does not give sickled cells. The most accurate test is the hemoglobin electrophoresis. Treatment. An acute sickle cell pain crisis is treated with fluids, analgesics, and oxygen. Antibiotics are given with infection or even to patients with fever and leukocytosis even if a definite site of infection has not been documented. Ceftriaxone is the preferred agent because it covers pneumococcus and Haemophilus influenza. Hydroxyurea is used to decrease the frequency of the vaso-occlusive pain crisis. Bone marrow transplantation can be curative in severe cases.